Good morning. I'm Dr. Srikanth Kulkarni, Medical Superintendent and a surgeon in BGS Global Institute of Medical Sciences. Today, I'm going to discuss on the safe surgical practices or safety in surgical environment. So what is safety in surgical environment? Safety is everybody's business. There is an Hippocratic oath from 5th century which says, never do harm to anyone. So what is this safe surgery? Safe surgery can be defined as a reduction in avoidable harm to a surgical patient. WHO, that is World Health Organization, has given 10 objectives for safe surgery. So what are these objectives? Number one, the team will operate on the correct patient at the correct site. Number two, use methods to prevent harm from administration of anesthetics while protecting the patient from the pain. That is, we have to use all the available advanced technologies and the advanced methods while inducing the patient before surgery. Number three, recognize and effectively prepare for life-threatening loss of airway or respiratory function. As we all know, the airway has such an important place in any surgical practice. So the anesthesia team will have to effectively prepare for any life-threatening loss of airway. Number four, recognize and effectively prepare for risk of high blood loss. So as a surgeon, we know what type of surgery we do and which surgery requires blood transfusion either pre-operatively or intraoperatively. So we should be effectively prepared with adequate blood and its products before surgery. Number five, avoid inducing an allergic or adverse drug reaction for which the patient is known to be at significant risk. So this is somewhat overcome by our latest EMR, that is electronic medical records, wherein once you enter the UHID of the patient, a pop-up window always comes out to enter the allergic history. So we do not forget to take the allergic history. So it is very important to take the allergic history of the patient. Consistently use methods known to minimize the risk of surgical site infection. This cannot be overemphasized. We all know how important the sterility, the disinfection, and the sterilization process is important in any surgery. Prevent inadvertent retention of instruments or sponges in the surgical wounds. Number 8, secure and accurately identify all the surgical specimens. Number 9, communicate and exchange critical information for the safe conduct of the operation. That is, communicate with your fellow surgeons to know the different modalities for surgical procedures and to conduct a safe conduct of operation. Number 10, hospitals and public health systems should establish routine surveillance of surgical capacity, volume, and their results. So these are the 10 objectives of the WHO for a safe surgery. Now, whose safety are we talking about? We are talking about the safety of the surgical team and also the safety of the patients. What does this surgical team mean? The surgical team consists of surgeon, nursing staff, anesthetist, and the attendants. So how do we benefit from surgery that is safe for our patients? So there will be less morbidity and mortality. There will be improved quality of our work. There will be less liability and greater efficiency in our surgical work. There are few important terminologies that have to be taken care of or that has to be understood for any safe surgical practice. The patient or the resident safety. It refers to the safety of both the patient and the working personnel. The operating room, also called as OR. It is a large, sterile, organized environment section in a hospital where surgeons perform surgical procedures on patients. Next is disinfection. It is a process that eliminates many or all pathogens, microorganisms, except bacterial spores or inanimate objects. Sterilization. It is a process of eliminating all forms of microbial life, including spores and viruses, from a surface or object to prevent the spread of infection. There are few definitions which are related to the safety incidents. One is the adverse event. What is an adverse event? It is an incident that results in harm to the patient. Next is a near miss event. It is an incident that could have resulted in unwanted consequences but did not, either by chance or through a timely intervention preventing the event from reaching the patient. A no harm event. What is a no harm event? It is an incident that occurs and reaches the patient but results in no injury to the patient. Harm is avoided by chance or due to mitigating circumstances. What are the factors that contribute to safety of the patients in a surgical environment? There are three important factors. The first one is the human factor, second one is the system failure, third one is the medical complexity. What are the human factors that contribute to the patient safety in a surgical environment? Inadequate patient assessment, delays in or errors in diagnosis, failure to use or interpret appropriate tests, error in performance of an operation, treatment, or a test, inadequate monitoring or follow-up of the patient, deficiency in training or experience, fatigue, overload, or time pressures, some personal or psychological factors, and lack of recognition of dangers of medical errors. What are the system failures which contribute to the incidents that happen in surgical environment? Poor communication between healthcare providers, inadequate staffing levels, a disconnected reporting systems, or over-reliance on automated systems, lack of coordination at handovers, environmental design and the infrastructure availability, equipment failure due to lack of parts or skilled operators, some cost-cutting measures by the hospitals, and inadequate systems to report and review the patient safety. What are the medical complexities? A complex surgery, advanced or new technologies which are not being used, or some potent drugs with their side effects which are not very well understood. So how do you manage? So these are the factors that contribute to the safety in surgical environment. Now, how do you manage these things in a safe surgical environment, or how do you manage these things to provide a safe surgical environment? Number one, right surgeon, right place and right time. So right surgeon means a surgeon of adequate training. Right time means selecting the patient's right time for emergency surgeries. That is, there should be no delay. If the patient has a requirement of emergency surgery, there shouldn't be any delay in performing the surgery. That is right time and right place. Next is the standardization of process. Once we standardize the process, we will not miss any of these procedures during the surgical procedure. So what are these procedures that have to be standardized? The pre-op investigations, optimization of malnutrition, DVT prophylaxis, antibiotic prophylaxis, and management of patient requiring emergency surgery. So these things have to be standardized so that all the procedures are clearly followed and nothing is missed. Next is the universal protocol. Joint Commission published a universal protocol for preventing wrong site, wrong procedure, and wrong person surgery. So it basically involves three principal components before initiation of any surgical procedure. Number one, pre-procedure verification process. That is, ensure all relevant documents and equipments are available before the start of the procedure. Number two, marking the operative site. That is, in procedures that require marking of the incision or the incision site includes those where there is more than one possible location for the procedure, so that we will not operate on a wrong site. Number 3, performing a timeout before the procedure. The operative team conducts a final assessment that the correct patient, site, and procedure are identified before the beginning of the surgery. Next, fourth important point in managing the safety in surgical environment, that is the patient involvement. This aspects involves the consent, the consenting of the patient, effectively communicating with the patient, explaining all the possibilities and the differential diagnosis and the other options to the patient in their own language. So what does it involve? The patient to be involved in such consenting, the personal effort by the surgeon should be taken to educate the patient during the pre-operative evaluation process. The surgeon should communicate openly with the patients and their attenders and obtain the consent, explaining the risk which requires skill to explain the potential harm of a procedure so that it is fully understood, because some patients may vary in their perception and understanding. So the information that has to be provided when seeking consent for surgery. The details and uncertainties of the diagnosis should be properly explained. The purpose and details of the proposed surgery should be documented. The known possible side effects and potential complications have to be clearly explained. The likely prognosis after the surgery has to be documented. Other options of treatment, including the option not to treat, also should be clearly explained to the patient. Explanation of likely benefits and probabilities of success for each option should be clearly explained. The name of the doctor who will have overall responsibility has to be documented. And finally, a reminder has to be given to the patient that he can always change his or her mind before the surgery at any time. Lastly, there is this surgical safety checklist, which is very important in managing the safety or having a good safety and safe environment in a surgical practice. World Health Organization has come out with a very good surgical safety checklist, which almost all hospitals practice nowadays. This is based on the international program, A Safe Surgery Saves Lives, which identifies specific checks to be carried out at 3 obligatory time points. The risk of error may be reduced by involving the entire surgical team in the site verification process and encouraging any member of that team to point out a possible error. This includes 3 vital checkpoints. One is the sign in, the second one is the time out, the third one is the sign out. What is sign in? Sign in is done before induction of anesthesia. That is, the patient has to be confirmed the identity, the site, the procedure, and the consent. The site should be marked wherever applicable. Anesthesia safety checklist should be completed. All the pulse oximeter and other vital parameters connected to the patient has to be checked and seen whether it is functioning. Any known allergy has to be documented. Any difficult airway or aspiration risk should be identified. Any risk of blood loss of more than 500 ml has to be documented. This is sign in, which is done before induction of anesthesia. Next is the time out, that is before skin incision. All this surgical safety checklist has to be done in an operation theater, that is in the OR, before starting the surgical procedure. The timeout, the second important checkpoint is the timeout, which is done before skin incision. All the team members have to be confirmed before starting the procedure by name and role. The surgeon, anesthesia professional team, and the nurse should verbally confirm the patient, the site, and the procedure. Any anticipated critical events has to be documented both by surgeons and the anesthesia and the nursing team. And has any antibiotic prophylaxis been given 60 minutes before the procedure has to be documented. The third important checkpoint is the sign out. This is done before the patient leaves the operating room. Here, the nurse verbally confirms the team, the name of the procedure that is recorded, the instrument, sponge, and the needle counts are correct if applicable. how the specimen is labeled, whether the specimen is properly labeled for further histopathological examination, whether there is any equipment problem has to be addressed so that this is not repeated in the next surgical procedure. The surgeon, anesthesia professional, and the nurses review the key concerns for the recovery and the management of this patient. This is the sign out. So this is the surgical safety checklist proposed by World Health Organization, which has three important components: the sign in, time out, and the sign out. In conclusion, in the surgical environment, safety is paramount to ensure successful outcomes and minimize risks to patients and healthcare providers. This involves rigorous protocols for infection control, proper use of equipment, adherence to aseptic techniques, clear communication among team members, and continuous training and education to stay updated on best practices and emerging risks. Thank you.